The symptoms of vitamin D deficiency are really going to depend on a couple of things. Number one, how deficient is the person in their vitamin D levels? And number two, how long have they been deficient? Because there are certainly different levels of deficiency. Guys, I'm Dr. Jen. It's good to see you. We are talking about symptoms of vitamin D deficiency. Vitamin D deficiency, first of all, write in the comments if you have a deficiency in vitamin D. A lot of people do have this. It is not uncommon. In fact, I have a vitamin D deficiency. I'm on high dose vitamin D from my doctor. Again, I see it a lot. I do test for it depending on the symptoms of the patient. So again, write in the comments if this is you. Now, let's start with, I'd say probably most of the patients I see in my family medicine office, okay? With say like mild to moderate vitamin D deficiency, 15 to 20 nanograms per milliliter or so, most of my patients have no symptoms of it at all, okay? It is very, very likely and reasonable that if you have a vitamin D deficiency, you didn't know it, and or you don't have symptoms. That's not uncommon because I would say a lot of people, if not most, don't have symptoms, okay? Now, there are tried and true sort of conditions that are very classic for severe vitamin D deficiencies. What am I talking about? I'm talking about number one, rickets. This is a condition we don't always hear about. Thank goodness for that. Rickets we tend to see in children. It's where the bones get soft and they bend. It's caused by impaired mineralization of growth plate cartilage, okay? So you get this sort of bowing of the bones. This is a very classic look here. Also, children with rickets oftentimes have osteomalacia as well, which is impaired mineralization of the bone. Now, in adults with severe vitamin D deficiency, you can see this osteomalacia. Those folks can get weak bones, problems walking, like a waddling gait, bone pain, muscle weakness, etc. Again, because of problems mineralizing that bone because there's not enough vitamin D. All right, so I just sort of told you two ends of the spectrum. I told you, oh, most people don't necessarily have symptoms, and then I told you like the severe vitamin D deficiency, rickets, osteomalacia, they're very, very severe, okay, manifestations. Now let's go back and talk about most of us in the middle of the road. I'm a family doctor. If you come into my office and you're like, hey, I've been feeling really tired lately, or hey, I've been feeling weak, or I've been feeling muscle pains, or I've been feeling my mood is down, or this and that, in addition to other labs, I'm probably going to check a vitamin D level. It is possible that people with sort of a vitamin D level that's deficient, and that can be a range of things. It is possible that you could have potentially mood changes, and in some cases it's been associated with that, so I will check that lab. Possible it could be associated with fatigue or muscle pains or things like that, muscle spasms, but not necessarily a slam dunk, but it's something I'm going to check for. Now, you've probably also heard of like vitamin D being associated with everything from heart disease to cancer to immune function to infection, inflammation, depression, multiple sclerosis. You know, the good thing is that there's a lot of research happening around vitamin D. I definitely think there's a lot more we're going to learn about vitamin D and the role that it plays in our body, especially when it's deficient, etc. But we don't have a lot of sort of solid, hard and fast, conclusive, you know, cause and effect data that says vitamin D deficiency definitely does this, definitely does that. There's just a lot we don't know about all that kind of stuff, okay? So keep that in mind. Now, is it important to treat a vitamin D deficiency if you have one? Yes, it is, okay? If you're vitamin D deficient, I don't want you to be. Now, what I wouldn't do is listen to all the people on the Googler Schmoogler saying, oh, you need this many units a day. They can't tell you how many units of vitamin D you need because your doctor needs to check your lab to see how deficient you actually are and think about your diet and then determine the dose you need. So don't just go taking a dose without checking with your doctor. Also, you can actually have too much vitamin D in your system that you can take by supplement. Some people have actually overdosed on vitamin D supplementation. I actually had a patient or two where this happened to. Guys, I have videos on the differences between vitamin D2 and D3, like the dose you should take, vitamin D toxicity, all that good stuff. I'm going to link those videos here. Let me know if you don't see them. Let me know in the comments if this was helpful. Guys, I'm Dr. Jen. It's good to see you. Subscribe to my channel on YouTube. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp. I'm at drjencaudle.com. Sign up for my free health newsletter. Guys, I'm Dr. Jen. Love y'all.